Suresh, sir?
Good morning, everybody.
Good morning, good morning.
Yeah, good morning. So start putting number.
Yeah, let's start, sir. Because I think we reached 100.
5 minutes, sir.
No, sir, let's start. I think that's better.
Start putting number.
Yes, sir.
Okay. Clear the ideal. Imran Shah.
Yes, sir. May I start, sir?
Okay. Voice clear ka?
Okay. Yes, sir. It's clear.
Okay. Start pannama.
Yes, I will start, sir.
Okay. So good morning to all. I welcome one and all for this 2-day online workshop on COVID-19 and its impact on society. I feel privileged to welcome our Honorable Professor Dr. Mangaleshwaran, Head of the Department of Social Work, Bharathidasan University, Trichy. It's a great pleasure to welcome our respectable today special chief guest, Dr. Babu Rangarajan, child and clinical psychologist, Salem. And I also welcome special guest, Dr. M. Prabhavati, assistant professors and head Department of Differently Able Persons, Bharathidasan University and Trichy. It's immense pleasure to welcome our senior professor, Dr. P. Ilango, associate professor, Dr. J.O. Jerida Nyanajo Iljo, assistant professor, Dr. Nirmala, and assistant professor, Dr. N. Rajavel, and my dear colleague, Dr. R. Karthikeyan and Dr. M. Selvamani. Last but not least, I feel happy to welcome our MSW students, research scholars, both MPhil and PhD, and entire participant various college in Tamil Nadu and Kerala. And I also welcome our sound technical persons, Mr. John Milton, Pugal Jodi, second MSW, and Leonie. Thank you. Once again, I welcome you all. Thank you.
Thank you, sir. Thank you for your valuable words. A warm good morning to everyone. Myself, Imran Shah, TM, Social Work Trainee, Bharathidasan University. I would like to start the session by acknowledging our culture. Let's have a silent prayer for our world. And
good morning to all of you. The most respectable resource person of the day, Dr. Babu Rangarajan, the workshop director, Dr. M. Suresh Kumar, the workshop coordinators, Dr. Imran Shah, Mr. Anbudurai, Miss Maria Sahuntala, Miss Malarvili, my dear colleagues in the Department of Social Work, Dr. P. Ilango, Dr. Jerida, Dr. Nirmala, Dr. Rajavel, and the guest faculties, Dr. Selvamani, Dr. Karthikeyan. Yeah, you can start recording. I think we'll start recording the program. Yeah. Karthik, you can start recording. Okay, fine. So let me first congratulate the students of MSW, especially these 4 students, Mr. Imran Shah, Abnbudurai, Maria Savuntala, and Malarveli, for taking up a very wonderful topic and the relevant topic of the day, because now we all know that the COVID-19 is highly impacting on the society, right? It has really disturbed a lot in all walks of life. I mean, to all the people across the globe, and especially now we know the situation that is prevailing in our country. So, dear, participants from India, I know that how the terrible is the COVID-19 situation in our country. So, you would ever since the WHO has declared the COVID as a pandemic since March 11th. We have been witnessing several cases and several deaths across the globe as well as the nation. And when you look into the recent statistics of the globe, right, almost 16 point uh, 116.4 crores have been affected by this COVID-19, and almost you see that 34.1 lakh death across the globe. And in India, you can see that the 2.55 crores have been affected by this COVID-19, and 2.83 lakhs death. And when you just look into the global scenario, it is about 15.5% of the globe which is being affected due to the COVID-19. When it comes to the death, it is 8.3% of the global scenario. But however, the one of the welcoming thing is that the death rate is quite less when it is compared to the affected people. It is just 1.1%. But to the great shock, I would say that there is a recent uh, recent article which is being published on May 8th, so which is stated that there would be a 1 million death of COVID by August 11th. So that is quite alarming to all of us. But I would see that that would not happen, because that is a quite different scenario and different aspect that is being
Yeah.
talked upon. And now you can see that the situation will definitely change. But when it comes to the COVID, we have been talking about wave one, right? In the wave one, we have been asked to put one mask, and the wave two we are used to put two masks, right? And now we are it is been sadly expected that there will be a third wave, and I hope hopefully they will ask us to put three masks. So that is the kind of situation that is prevailing across the nation. And so you see that the as Aristotle and the famous philosopher said that man is a social animal. He cannot live in isolation. He is always in chain. So this now it has to be rewritten, or it has to be think in a different forms. Now we ask the people to live in isolation, and we want to break the chain. So that is the kind of situation that we have right now, we are prevailing. And when you look into the effects of this COVID-19 and the lockdown we had last year, and presently we are being witnessing, it has really created a lot of disruption among the public. This catastrophic of COVID-19 has disrupted all walks of life. People who are in the unorganized sector is being very drastically affected, due to this economical economically we have been put down in many ways, and because the livelihood is being very much challenged. So in that way, you know that this kind of seminar, right, this kind of webinar would definitely help us to overcome certain things. And especially when it comes to the academic scenario, now we are all gone for a digital digital literacy, right? We should be digitally literate, because now the education, there is a sea change in the system for the past 1 year. So now no more a classroom culture, so we have gone it digital. So there's lots of challenges for the students, but especially when it comes to the rural students, I feel that lots of challenges is being faced. So that is a kind of impact, because I would see witness that many of the students are running in the streets, many of the students are playing cricket, and totally I hope that there will be a not a knowledge gain. For the past 1 year, there is no knowledge. So this is the kind of kind of you would see in the rural population. And the small scale industries and the people who are the street vendors and unorganized sector are quite, I mean, very, that was a very damaging effect on those people. So not only this particular thing due to the death of nears and dears. Of course, you have around 100 people who are participating over here through this Google Meet, and as well as people who are watching over the YouTube channel. I know that you would have come across many news that some of your nears and dears would have lost. So in this context, so our mental health has to be built. We have to build up a good mental health strategies. We have to build up a good mental health. I mean, a strong mental health aspect is very need of the hour. And at the same time, how we are going to look into the future. So that is a quite another thing. So maybe the COVID-19 will fade away from us in a couple of years. I hope that that will go away. But how we are going to restructure our nation, how we are going to develop, I mean, build up the economic, how we are going to build up the structure of the society, and how we are going to. So there is a quite number of challenges that is being put forth with us in recovering things, right? The resilience we talk about as a mentor. I think Mr. Babu Rangarajan will be much talking about the resilience factor, because now the resilience is the need of the hour, and how we are going to overcome all kinds of challenges that is put across over a period of time for the past 1 year. So my dear participant, I hope that this particular webinar will be an eye-opener for many of us to understand the nitty-gritty of the COVID situation with the facts and figures. And but not only the facts and figures, but also the recovering of the people from the COVID-19 situation, both the social, economical, and mental well-being is the need of the hour. So with this few words, let me once again congratulate the students who have been taken very much pain in organizing such workshop, and also congratulate Dr. Suresh Kumar, who has been taking a leadership role in guiding those students through this will definitely wide spectrum of knowledge in relation to the COVID-19 and its impact on the societies. With these few words, so let me thank the organizers for giving a wonderful chance for me to share my views on the facts of COVID-19. Thank you very much.
Thank you so much, sir, for your valuable and informative words. I'm glad to say that today we have energetic and a fantabulous speaker, Dr. Babu Rangarajan, child and clinical psychologist, to talk about our today's topic, COVID and mental health. He is an registered clinical psychologist from Rehabilitation Council of India. Currently, he is chairing CEO of Happy Career of Career Development and Aspirations NEET and G Coaching Institute, and consultant clinical psychologist at AP Medical Center and Hospital at Salem. He conducted many programs out of our country, mainly Malaysia, Kuwait, UAE, etc. He already conducted 700 plus workshops till now. We can proudly say that he has been actively taking lecture in 200 plus webinars and workshops. And last but not least, he is an elite world recorder by conducting 24 hours webinar marathon. I think this is more and more enough to introduce himself. And so resourceful resource person is here to start the session. I would like to welcome you, sir, behalf of my university and department, behalf of my workshop team. This session is yours. Thank you.
Okay, that's great. Thank you so much for the great opportunity to share my experience with you all. All the participants, are you all ready for the new learning? Before going further, I need to thank this wonderful department who's organizing the fantabulous, most wanted training webinar is happening from Department of Social Work, Bharatidasan University. A special thanks to young team which is looking forward to help people to overcome their mental health. So my first special thanks to the second year MSW student, start from Imran Shah, Anbu, and then Maria Sakuntala, and then Malarvili. Thank you so much. You have taken a good initiative and you became an inspiration for the young people to start something for the community. This is a situation where we need everyone, whoever the knowledgeable, whoever the person whose department health, related to community health. Definitely, this is a chance where you come out. Don't wait for somebody to give you opportunity to work. You create your own opportunity. How these four youngsters, they started, they thought some idea that they wanted to spread some community message to everyone to transform from this crisis situation. Same way, everyone, I have seen all the chats here that all research scholars from different part of the place in entire country which they are participating here. I know this, whatever you are learning a message from here, definitely pass this message to everyone wherever you are. Right. So first of all, I thank my MSW department HOD and then the coordinator, Dr. Suresh sir, for giving me this wonderful opportunity. And you are giving an opportunity to host from the youngsters. That's amazing. I know I'm proud of your department. You are giving opportunity to youngsters to explore their skills. Great initiative. So let me move on to my today's webinar about COVID-19 and mental health. Yes, such a wonderful topic and the most important topic. Even I've been invited here, I'll be sharing my experience. I'm working with the COVID-19 patients in my hospital. I'm a consultant clinical psychologist at AP Medical Center Hospital, and we have our own patients here. And then I'm working in front. It's not about telephonic counseling. I'm going in front and I'm helping them. I know how researchers are saying first symptom was noted in China in December. So from that moment, it starts spreading, and now it's coming up with a big time. Last year we had a long time lockdown, but somehow we coped up, and then we didn't see the emergencies what we are seeing right now, which was not here in the last year 2020, but 2021 it's gone in our it's spreading a lot of places. A lot of people are suffering with oxygen challenges. So this is what the COVID-19 and this is what been introduced by WHO. They noted this is something called coronavirus, and January 30 they published, and everyone noted it's from China. And then this is a infectious disease where it's spreader from human to human through this their mouth. The virus is spreading accordingly. So can we move on to the next slide, sir? Yes. So this is what we need to understand about impact. What kind of impact it gives in the psychological health. Everyone was comfortable leading their life, moving forward. They're enjoying their own life. Once this is introduced, this coronavirus came into our country, in the world, what happened? That impacted in the many people's life. Even the last year wave, last year of impact, still some people not yet overcome. But again, now with the second wave, which impacted us, and it gives you a lot of trouble. And I don't know how the last year people not yet overcome. Again, they are suffering now. We don't know what will happen to the human mind. So this is what happened. The relationship here, you can see it starts from outbreak of COVID-19 and the lockdown. It impacted, these are all the areas where we are impacted in psychological, and the media influences a lot, and then we are getting a lot of news from somewhere. Whether it is right or wrong, we don't know, but we are getting lots of newses, and it is a critical crisis, and it's fear. It's a fear of getting virus, and the fear of quarantine. And now there are many people, they're facing financial crisis. That's a major challenge for impacting our psychological. There are few people worried about their financial status, EMI, what to do next, how to live our life, to feed food. There are so many people are suffering with financial crisis. There are so many people who are worried about the virus. There are so many people that are worried about whether I'm going to suffer from the virus. So many things are happening inside that affect, psychologically. What will happen when the person is affected psychologically? This is a challenge here. This is a mental health challenge. So people who are affected, and they will be experiencing irritability, fear of contracting, spreading infection to family. These are all some of the worries, anger, confusion, frustration, loneliness, denial, anxiety, depression, sleep problem, and extreme consequences. Some few, very few, they are thinking whether I need to live this life or I can go away. This is a problem scenario. This is what happening, my dear friend. The mental effect, we don't know. There are few people, they worried about their health. There are people worried about the financial crisis. They're worried about whether they're going to affect in the future. They're worried about the age factor. There are few people, they're worried about the age. Senior people, elderly people, they were being, mentally affected because they're worried about feeling insecure, whether I may be getting catching up this kind of this problem. So, sir, can you go previous? Yeah, thank you. Yeah, please. Thank you, sir. Thank you. Hold on. So this is how it affects, mental health. We don't know. Some people are going through so much of trauma inside, but we don't know how many people are suffering. But I've been to telephonic counseling for many people in my places. They used to contact me and saying that they're worried, they are feeling anxious, they have been suffering a lot because of, the news. They saw in the news channel, and they're seeing that so many messages have been passing out. People are suffering with oxygen, and they affect himself doing that. They also suffering with corona, but they were not feeling any symptom. But mentally, they are thinking they may get coronavirus and they suffer a lot in future and they will die. This is happening in the elderly people's mind. No, I'm not talking about all, but there are few people. It depends upon how you cope up the situation, right? We need to have some coping mechanism to handle the situation. There are few people, they go undergo a lot of pressures. So can you move on to the next slide, sir? So I want to talk about how media influences our mental health. So you can see in social media whatever you are being comfortable with, from YouTube, WhatsApp, Facebook, Insta, Twitter, everywhere there will be lots of messages. I don't know whether the message is true or not, but sometimes that message is also giving an impact on our mental health. And if you see in the last 1 month, if you see in your Facebook or Insta, you can see many people post saying that RIP. If you come across, that will also, again, it will influence you. And ultimately our mind will go and see what is his age. Oh my god, just 30, just 35, just 40, he passed away due to corona. Oh my god, that again affects your mind. We start, browsing. We listen to all the news channels. They come out with lots of messages saying that this part of the place has so much of virus, and they blocked. They suffered. People are suffering for, getting placed to a hospital. When you listen to this kind of, informations, what happens to you? If you have the coping mechanisms with you, you don't get affected. There are few people, they don't know how to cope up with this kind of crisis information. They get affected. They go into depression, phobia, panic, depression, whatever you wanted to call, all kind of mental health challenges they are in. And specifically the delusion has come in. Sometimes, they start, false belief is called, delusion, right? They start, thinking about whether something is going to happen, somebody is there, something is going to come in, so much of thing. And there are a lot of people, they develop obsessions. What is obsession? They keep washing their hand for a long period of time. So this was, we as a mental health practitioner, we used to diagnose this, call it as a OCD. There is a diagnosis called OCD, obsessive compulsive disorder. And that will be like repeated thoughts and repeated action. There will be a lot of, measures to diagnose. Not everything, repeated actions are not qualified as OCD. There will be a list of symptoms to be qualified. Now what happens is, there are a lot of people, they started worried about whether I will catch the virus. They come and they wash for repeated period of time. They will not get satisfied with, 3 to 4 times of, washing. They keep washing. Again, that anxiety is not leaving them. No, maybe I may get again, I'll go and wash. No, this wash is not sufficient, I need to again wash. Some people, they go into obsessed thoughts, and they go into depression. They go into guilty feeling. What is guilty? Guilty is that something which I may trouble my family. Because of me, maybe my parents will be disturbed. My parents, my family members will suffer. because of me. So they go into a lot of pressures because of the guilty feeling. So please, these all the media also make health seeker to get into catastrophic feeling, right? So make sure that we passing any right message, or are we influenced by any of the message passed by any people? All right. So please make sure your mental health is also influenced by the social media or the mobile which you are using, right? So if you take your WhatsApp, search for WhatsApp, sometimes many times when you morning when you wake up, and we have an habit of seeing WhatsApp status, this one messages, is there anybody's given any message? If you see any of the groups, if you watch, definitely they'll be talking about COVID-19, this situation. So I'm not saying avoid all those things, but don't influence by this kind of social media messages. We need to be more stronger enough to make ourselves get ready to face this challenge, which I'm going to talk to you all today, how you can overcome these challenges. This slide, which I wanted to spend some time here, this is a very, very interesting slide. What happens, when you get, people getting positive with the symptom of coronavirus, COVID-19 symptom, what happens is they go into anxiety. You know what? Last year, this kind of anxiety is not much seen, last year, but now there are a lot of anxieties are coming in. A lot of people are undergo panic. I'll tell you why. There are so many celebrities who got affected with COVID-19 and passed away. That influence, what we are today is based on our past experience. We have a lot of we function based on our past experience. We have a lot of past experience. That's why we are leading our life on a daily basis. Though this COVID-19 patient, whoever comes to hospital, either private or either government hospital, whoever they admit, what happens to them is they get into this kind of a panic and anxiety and feeling lonely, because nobody's around. Nobody, the known people are not around with them. That's the biggest challenge for them. Being in a lonely place where nobody's around known people and feeling insecure, and they were not aware whether they will recover or they will go back home or they will be die here itself. There are a lot of challenges which they are going in, and there will be few people they undergo guilty feeling because of them. Maybe some family members they got affected COVID-19 symptom, so they feel guilty when they come to hospital. They start feeling and worried about, they blame themselves that because of me my mother is suffering. My mother never goes anywhere. I'm the one who is a breadwinner of the family. I used to move around for living, basic living, or buying something for our food. So because of that, somewhere I catched, but I spread it to my children, my family. I feel shame on me. I feel worried about this situation. Because of me, everyone got affected at my home, and everyone is quarantined. I don't know what they are doing, and I'm the one who is in hospital. I'm not sure what happened to them. That's a guilty feeling which they undergo here. Due to that leads to depression. Please make sure, there are people who are quarantined, there are people who are positive, they undergo a lot of challenges. Whereas I am in a particular hospital. I'm a consultant clinical psychologist. I meet clients and I help them. I listen to them. I do psychotherapy with them. So that's important for them. They all feel very happy that whenever I visit them, they used to say one thing, that I was looking for someone to listen to me or talk to me in a polite and a happy way. I'm happy that I'm seeing you on everyday basis. That's what the comment which I received from these people. They worried a lot. They don't know what to do. They want somebody, to strengthen their emotion. They want somebody to give confidence, and the thought process is keep running, and which is hurting them, because everybody has a thought process, right? You have a thought and I have a thought. It keeps running, and everyone has this called preoccupied thoughts. What is preoccupied thoughts? Though you are listening to this presentation, but your thoughts have been wandering somewhere, right? That's called preoccupied thoughts. So that preoccupied thoughts which running in our mind, that influences our feeling. That's reason people are getting this kind of feeling changes, right? So please make sure that if any possibilities are there, you can help them with positive way. You can support them. I'm going to give you a strategies and techniques how you can work with any of the people who are facing anxiety, anybody who faces depression. This strategy, sir, please, sir, you can wait for my instructions, sir. Please move on to this before slide, please. Yeah, thank you so much. Please hold on, sir. I'll be giving you instruction. You can change, sir. Thank you, sir. Thank you so much. So let me move on to the children. What happened? Though they are at home, but they are not going to any schools. Some students are going for online schools. Some they don't know what they are doing. Children also face anxiety. You know what? It's not about the coronavirus. It's about how I can go to school. Why? Because they were not aware what is happening in the country, what is happening in the neighbor, what is happening in your street. You know, they worried about why I'm not going to school, why you're not allowing me to go out and play. You know, some parents they restrict them to be at home. They also going to undergo some kind of a fear. They feel irritable. Their emotions are changing. Sometimes they go into boring, and that's the reason they do all kind of irritable behaviors at home. That's how they are being behaviors are changed. So children also undergo lot of emotional changes, and they were not in a system, right? In a school has a system where they can go and study, and they have a homework, they'll be scheduled. But what happens here now, some are in online school, yeah, there will be some kind of a homework and assignment, there will be schedule, the system structure will be there. There are few people, they don't have that online school, but still they don't know how they are going to run their life. They just waking up very late and they sleep late, their times are changed, and they're not in a normal schedule. That also influenced a lot in their mental health. So please make sure, as a parent, if you are any of the parents are there, the children has to be in a schedule. Let them give some responsible work in the morning, either academic or either household, either a project, whatever it is. Make them engage, make them do some engagement, so that they can overcome the preoccupied, unhelpful preoccupied thoughts, so that they can be comfortable and happy to lead their life. When it comes to healthcare providers, yes, they also face a very big challenge. I'm seeing in real, healthcare providers, start from doctor, nurse, and supporting staffs who works in the department of COVID-19 department. I'm seeing lot of people, they undergo high level of stress, because they have to wear to protect themselves with a full of the PPE kit. You must be seeing the blue color and white color kit which they use to protect themselves. Not the cover itself. Even I used to wear for 2 to 3 hours a day. That gives so much of suffocation. It's full of sweating, and it's very difficult. We get dehydration because of that. Wearing for a long time. That's the biggest challenge. And sometimes patients who are insecure, they also show irritability, and they shout at the nurse and support staff working in the ward. They shout because they're shouting because they're feeling insecure. They're going to go a lot of pain inside, and they suffer a lot with the breathing difficulties. Sometimes they ventilate. So they have to listen. Oh, the healthcare providers has to listen and understand the challenges, how the patient is undergo, and whatever they scold, just to maintain the silence. That put them down, going into fear. And they also, some of the hospitals, they are not allowing them to go home for the working for some particular period of time, and they have to quarantine for some particular period of time. After that only they are allowing to go home. That's all for the safety purpose, but they also feel lonely, and they also feel fear of getting infected, because of working with all the positive patients. Sometimes they also undergo some kind of fear whether they will also catch or something. So even lot of people, they undergo this kind of pressure. Even healthcare also, they are getting under pressure. And even that support staffs, they undergo lot of pressures. And in general public, what happens to the public also, they find some difficulty getting into access for the medicines. That again the biggest challenge. They also getting a lot of challenges to get into medicines. There's some medicines maybe hospital cannot able to provide, or it's a scarcity, or maybe which is not available easily. What happens, the caregivers outside, they roam around getting medicines in a black market, or whether it is not available, running here and there to find out that medicine to save the person loved one who is already there in the hospital. Again, they undergo lot of pressures. And in elderly people, again, they feel insecure. They don't know whether they will, anytime they will get catch up with this kind of virus. Lot of pressures are going on. And compared to wave 1 and wave 2, huge difference in public's mindset now. Because I know anyone who is listening this webinar, I could have tell you 90% of the people might experience in your Facebook a known person is expired due to this, or if in your street anywhere nearby 100 meters someone has died, you must be heard some news. This is possible because somehow some known people are, we are losing at this second wave. So that leads to a pandemic, and that leads to panic for the many people to adjust and digest something is happening here, in this situation. So that's a challenge of people who undergo lots of mental health challenges are happening. So what to do here? If the people are undergoing lots of pressures, lot of stress, depression, anxiety, what to do, how to overcome this challenge? So can we move on to the next slide, sir, please? Okay, thank you so much. This is what we need to do, my dear, all the participants who are attending this webinar. I'm going to give you some technique which is very useful. You can use it for anyone who are meeting here. So what happens here is the coronavirus is everywhere. The COVID-19 symptoms, somewhere it is roaming around, and few places it is locked down. Even I'm from Tamil Nadu, where here is a lockdown, and we are not supposed to go out and roam around. So coronavirus is happening, and there are so many people suffering with worried about symptom. They affected with symptom, and they worried whether they will get affected or not, or sometimes financial challenges. So whatever it is, what happens to you? The situation is this: you're thinking, what kind of thinking you are roaming in, what kind of feeling you are experiencing, and what kind of behavior your feeling changes, and accordingly your behavior changes. This is what I wanted to teach you all today. Yeah, a famous technique is called CBT. So can we move on to the next slide, sir? This technique will help you to understand, to overcome your whatever the challenges, mental health challenges are there. So can we wait here? This is a one interesting model, and I think this is my last slide of this webinar. Okay, this is the last slide. Please take this as a very good technique and pay attention here. Definitely you will get a lot of take home message. You can help many number of people with this model. Okay, I am helped with this model to many number of clients, whoever is positive, negative, and the public, elderly, whoever people they meet, I teach this technique. All right, this model goes like this. According to feeling, your behavior changes. According to feeling, your behavior changes. What kind of feeling we get every day? We get happy, sad, fear, anger, love. These are the normally we experience. There are 100 plus feelings we can name it, but all synonyms of this: joy, excited, all I put it as happy here. So feeling of sad, grief, I'll put it as a sad here, and feeling of fear, anxiety, all you put it as this one. So if you understand this, what kind of feeling you are experiencing on everyday basis, that feeling changes your behavior. If the person who experience happy, automatically his behavior will be very active, energetic, doing work here and there and enjoy the moment. And that's how the feeling will introduce a behavior. If the person who is experiencing happiness and love is automatically associated, the love, what I mean here is helping, caring, understanding, motivation, involved. These are all I mean love here. So when you're happy, then automatically you have sharing, caring, motivation is automatically there. If you experience sad, what happens when you experience sad? Your behavior changes into feeling alone, feeling aloof, not interested in daily routine. You take your sleep will be much more extra, or you don't sleep at all. You sleep a lot, you don't sleep at all. You eat a lot, you don't eat at all. There are a lot of disturbance in physiological changes, and sometimes the people they cry if they experiencing more number of sad. And if the intensity of sad will be much more higher, we call it as a depression. In depression, you have a mild, moderate, severe. If any person was suffering with severe, and they thought they wanted to go away from this world, suicidal thought will be much more higher if the person who has severe level of depression. So fear, what will happen if the person who experience fear, the behavior changes into heart palpitation, choking sensation, restlessness, tremor, sweating, all kind of behavioral changes they get. And what happens if the person who experience anger, if the person who experience anger, I call it as a mad behavior. Mad behavior. What is mad behavior? They were not aware about what they are doing. They were not aware about what they are speaking. They lose the awareness. That's called the mad behaviors, right? If you experience anger, definitely you may lose some consciousness. Sometimes you shout, you throw objects, you break. Sometimes we realize after 1 hour only, oh my god, after 1 hour only they realize I broke my cell phone. After 1 hour, they realize something had happened. So this is how the feeling that influences your behavior. So we need to know who is changing your feeling. Though everyone wants to be happy, but still people are experiencing different kinds of feeling on everyday basis. Even now, today also you must be experiencing morning as soon as you wake up, you felt very happy, and sometimes you go into different mood, and then you're attending this webinar. We don't know what kind of mood, what kind of feeling you are in right now. Your emotions are keep changing, right? So that's how your feeling influences your behavior. So who is disturbing you? People always say it's a situation. Usually we ourselves change our emotion based on our situation. So we have a lot of situations, right? You can see morning, if you are at home, that's a situation. When you come back to your institution, or when you come back to any of the workplace, your situation changes. You have a leadership hierarchy, somebody you need to report. If you are you comfortable to report to a senior authority? You check yourself before leaving your room. You are comfortable. When you are leaving your room to reach your authority, what happens to your mood during that particular phase of walking time to reach the higher official's room? Check yourself. Your emotions are changing accordingly, right? Your situation changes your emotion. That's what people always say. I've been influenced by these people, I've been influenced by situation, I'm being influenced by the situation. I always say it's not because you are disturbed by the situation. I always say situation is not disturbing you. It's not that situation is disturbing you, it's your own thought. It's your own thoughts. The thinking changes your feeling changes your behavior. So please understand here, your thinking only disturbs you. It's not about the outside situation. How to understand your thinking? Can anyone tell me how many thoughts we are getting every day? Already I given answers here, but even though I need to check, are you convinced with this answer here, whatever I given here? The researchers are saying, we experience every day 40,000 to 60,000 thoughts cross by. Do you believe that? Do you get 60,000 thoughts or 40,000 thoughts? And we must be aware about 100, 200 thoughts, right? But researchers are saying we are experiencing 40,000 to 60,000 thoughts cross by. So how these thoughts are coming is called automatic thoughts, automatic generating thoughts. We have two kind of thoughts. One is um, the automatic thoughts, like positive automatic thoughts and negative automatic thoughts. They call it as a pat and nat. Positive automatic thoughts is called pat, negative automatic thoughts is called nat. So these are happening inside your mind without your knowledge. It's just coming in. Even now you are being occupied with some of the other thoughts. Who knows? Something which is occupy your mind. That's called automatic thoughts, which we don't have a control over, but it comes automatically. When you walk in a street where you get a smell of biryani, what happens to your mind? When you move out also, when you move out that street also, still you remember about biryani for a long period of time. So it's just running inside your mind. When you get a nice smell of coffee, then your mood changes, when the smell comes in, and you will be preoccupied with coffee, and you had a pleasant experience when you had a coffee in a beautiful place, the nice location, or tastiest coffee you have ever tasted. That starts coming in your mind, and you will be busy in that world, and then for some period of time, and you will be inside. You don't know when you are coming back from the situation. So this is what every human being happening. So we are being occupied with 60,000 thoughts crossed by every day. Where you give priority, your thoughts have been wandering. For example, if any of your students who is attending this webinar, and I can tell you, if anybody from your department, higher authority, they are saying that next week you're supposed to write exam, what will happen to you? Your your occupied thoughts will keep running inside, and it's just running and saying, oh my god, no, within 1 week how can I rise? No, I didn't finish that portion, I didn't finish this portion, I need some clarity on that particular part, and I need to discuss with my friend, I need to talk to my teacher, I'm not confident enough, I don't know, I have some other projects to complete within 1 week, and the deadline is also for the exam. I'm not sure whether I can write my exam. The confusion starts coming in. Your thoughts have been wandering about your exam continuously. That's what where you give priority, that's your thoughts preoccupied. When you had some kind of a argument, heat up argument at your home before you leave your place for your workplace, that heated argument will be keep running your mind some more number of periods of times, that keep running inside your mind whenever you are doing some other work, but still the preoccupied thoughts keep running, and your friends must be identifying you, saying that, oh, you're not normal, you're looking dull, can I know what happened to you, do you comfortable, your face is different. You must be getting this kind of feedback from your known people, right? That's what your preoccupied thought, you are not wantedly doing, but something which keep running your mind without your knowledge. Even while you driving also, you can see, while you drive your bike or car, for this number of time distance, right, maybe 10 minutes to half an hour to 1 hour, whatever the distance you wanted to cover to reach your place, during this traveling time you are not concentrating on your road, you are preoccupied with some of the other thought. There are many people, many businessmen, they get a beautiful idea while they drive, okay, they get some brilliant ideas while they're driving, and they got good pleasant ideas, and they make a note and they come back to the boardroom and then and get that finished of that thoughts. Like that, we also get so many number of thoughts. That's what I wanted to spend some time here about, how many thoughts we are getting every day. There are 40,000 thoughts which cross by every day. If you know how to change your thoughts, then automatically you can change your feeling, and automatically your behavior will be very comfortable. Why people are getting palpitation, why they are restless, why they are crying, all the behavior, why changing? Because of the feeling changed. That's why they are experiencing this. How to change your feeling? You need to work on your thinking. If you modify your thoughts, your feeling is taken care. And they'll be asking many questions. How my thinking will change my feeling? I'll tell you one interesting thing. You can understand here easily. What happens is when your thoughts are changed, when your thought changing accordingly, that give message to the neurotransmitters. As you all know, there are few neurotransmitters which controls our entire body, right? Dopamine, serotonin, epinephrine, non-epinephrine, and oxytocin and endorphins. These are all some of the messages which give message to everyone. It's called neurotransmitters. So please understand here, your thoughts releases message to neurotransmitters. The neurotransmitters give message to entire body. So if you are giving message that, I'm in a scared, I'm feared, this situation is not comfortable, you are giving signal to serotonin. Serotonin gives message to everyone, and your message reached to create your anxiety. Serotonin is a stress producer. It gives message to adrenal. Adrenal gets flashed, and the message goes to cortisol, and cortisol gets flashed, and it gives signal to heart. The heart gets palpitation. This is all the sweating and all the bodily changes. Body, sometimes they get heat, sometimes they get chill, sweating, restless, tremor. All the things happen because of the neurotransmitter, which gives signal to entire body. So who releases, who controls this serotonin? Our mind is controlled. The thought what you hold inside, that gives signal to the neurotransmitters. The neurotransmitter gives signal to your feeling. All right, so let me move on. How to change your thought process, that's what the most important is. So if you are seeing my video, so look at my action now. Look at my action. If you are seeing my video, so I'm showing some action in my hand. Can anyone interpret and tell me what is this, what looks like? Can you tell me what do you say about this action? You can come in the chat box and kindly give your response first. Yeah, come in the chat box, yeah, chat box will be fine. Yeah, what do you see in this action? What do you see in this action? Yes, come in the chat box, please. So long time you're just listening. Can we have some interactions? Type something in the chat box. What do you see in this action? Yeah, stop sign. Okay, stop. Very good. Thank you so much. This looks like a stop. Okay, what else? What else? What else you can interpret on this? Hi. Yes, they say hi, hello, how are you? They say with the hands, right? Yeah, good, very good. Good guess. Any other way you can see this action? Yeah, tell me. Yes, yes, everything is right. Just tell me. Yeah. Hello, yes, hello, five. Yeah, yeah, I'm communicating five. You're offering high five. Yes, yes. If you show this hand to less than 5 years, they'll give you high five. High five. Yes, high five. Correct. High five. Good going. Some people they think this as a blessings, right? So blessings. God bless you, right? No, sometimes we bless. So what else? What else you see with these actions? What else?
Wait,
So
wait.
I'm here. Yeah, wait. Yeah, wait. Correct. Wait. Can you please wait for some time? Yeah, very good. I'm here. Hi, I'm here. Yes, very good. Thank you. Thank you so much. Yes, high five. Bye. Waving off bye. Yes, super. Thank you so much, my dear friends. So, with one action, everyone is interpret it differently. Yeah, someone may say, may I come in? Very good. Excuse me, may I? Yeah, very good. So, phi sign. This is looks like a fine. So, why I showed this action is whatever you see, it's based on your interpretation, based on your past experience. You just try to interpret this action, right? Someone will interpret as a phi, someone will interpret as political symbol, someone will interpret as a blessing. It's all up to you. There is no single answer. It's everyone has their own way to understand, but one thing is sure, that it is not the one single way to interpret. Interpretation can happen multiple ways. So that's what I given here is interpretation. Interpretation is nothing but the way how we understand, the situation. That's called interpretation. So we understand based on our past experience. So now, can anyone tell me what is this? If you look at my video, I'm just showing something. Can you tell me what is this? Can you tell me what is this? Yeah, what is this?
Drumming.
Drumming. Okay, drumming. Yes. Okay. What else? What else you can say? What else you can say? Yeah, tapping on the bottle. Wow. Bottle cap. Bottle. Very good. Cap. Okay. Caps. Sound. Bottle. Okay. Great. What else? Touching. Yeah, I'm touching the bottle. Good. Cap. Fantastic. All right. That's what again an interpretation. So you can do an interpretation differently. Someone will look at the bottle. Someone will look at the cap. Someone will look at the tapping. Someone will look at the action. Do it's absolutely up to you how you interpret inside your mind. Your interpretation changes the perspective, right? So interpretation is not a single interpretation. It's up to you. You can have a different kinds of interpretation, and how you interpret that changes your thought process. That thought process influences your emotion, and that emotion influences your behavior. That's it. That's how we need to be very clear about. If at all you wanted to work your thoughts, if at all you wanted to change your thought, please work on your interpretation, because we don't know how to modify our thoughts. And everybody knows think positive. That's a very oldest term which we've been listening from our childhood, saying that think positive, think positive, think positive. How to think positive? Just understand this. Your interpretation will reflect on your thought process. So self-talk, next interesting tool here to change your thought process. Self-talk. What is self-talk? Can anyone tell me what is self-talk? Do we make self-talk? Do we talk to ourselves? Is it a self-talk happening with you? Can anyone tell me what is self-talk? Yes. Thank you for the response. Yes, we talk. Yes. Can tell me how, when you talk, we know that we are talking, but anybody aware that we talk on particular situation? Can anyone tell me which situation we talk? Uh, what made you to talk for yourself, talking to ourselves by facing a mirror? Yes. Thank you, Imran. Sometimes we used to see mirror and used to talk. Yeah, I look like Imran Khan. I look like Amir Khan. Sometimes when we look at we talk to ourselves. I look like some kind of a Bollywood actor. So the hairstyle looks like this. Good, thank you. So just for fun, I just introduced this. Okay, so spent alone. Yeah, whenever we are alone, we talk. Whenever we tense, whenever we spend time with us, we talk to ourselves. Good. When we take decision, we talk. When we are lonely, we talk. Wow, very good. So very good. Thank you so much. When internal dialogues are going on, perfect. Very good. It is going on. The situation that makes us happy, like when we about something that we aspire to become and we feel happy. Wow. Very good. Talking is also a self-talk. Thinking is also self. No, sometimes when you are self-talk, it leads to your thinking. Yes. To motivate ourselves, we talk to ourselves. Very good, very good. When I'm tensed, we talk. Super, very good. So giving honest feedback to ourselves, yeah, we used to talk. Yes. While meditating, very good. While meditating, I don't know whether you are talking or not. While meditating, you are not supposed to do anything. Just focus and be with that. That's how meditation is. If you are talking while you meditate, that's great. Correct our mistakes. Sometimes, oh, why I did this mistake? I need to correct myself. No, I need to change. Others don't respond. When I'm talking to somebody, no response comes in. We talk to ourselves. Hereafter, I will not talk to this person. Correct. We used to talk to ourselves when no respond. Yeah, thinking. While you think, you talk to yourself. Okay, thank you so much. All your response. Self talks are happening every second of your life. Every second you're talking to yourself. That's what the researchers are saying. Even right now, you're talking to yourself. That's why you're given the response. Why you given the response? Oh no, I wanted to give my response. Yes, I know. I was being experiencing self-talk in my mind. I wanted to give my response to them. That's the reason you talk to yourself. That gives you, the action. That's why you are given a response here. There are few people, they talk to themselves. No, I don't want to type anything. No, I don't want to share myself to anybody in the group. Let them share. I don't want to share. That's a self-talk which hold you not to share any information from your side. You're just watching this webinar. Self-talk which controls your behavior. Self-talk, how it controls your behavior, self-talk is a thought. It creates a thought, and it creates a feeling, and it changes your feeling. This interpretation self-talk, this two channel, we can modify our thoughts. It's a very simple model. Please understand. If you modify your self-talk and interpretation, it changes your thinking, and automatically your feeling changes. It's very interesting model. And I'll give you one example, how our interpretation self-talk changes our thought process. Let me ask one question to you all. Do you all have a refrigerator at your home? Refrigerator. If you have a refrigerator, I don't want any answers here in the chat box. Please talk to yourself and answer it by yourself, not to open any of the mic. What color this your refrigerator is? When you open the refrigerator, what you kept in the door? When you open the door, what you kept in the door? What comes to your mind? When what kept in there? So in your main fridge, when you open the tray in the end, the main tray in the down, if you lift, if you open the tray, what you kept in that? What are your answers you are giving? Do you try to recollect the picture in your mind? Am I right or wrong? So if you try to answer my question, you are trying to remember the picture of your refrigerator, the white color, and the big fridge. When you open, you see egg over and the water bottle, and when you open the tray, you can see a lot of vegetables inside your picture. It comes or not? That's what this self-talk and interpretation plays a major role. So what happens is, when you are trying to talk, your thought process changes accordingly. So we have a culture in India. We always, whenever you meet, we greet, right? Whenever you meet a person, you greet. Hi, hello, how are you? That's a question we ask everyone, right? How are you? Sometimes people say, I don't know, nothing is happening because of coronavirus. Nothing is happening, just moving on. I don't nothing. Yeah. What happened when you talk to narrate yourself like this? You are creating a picture inside, dull images that influences your feeling, that influences your behavior. You look dull. And that's a system which is introduced in our culture, saying that whenever somebody is asking, hello, how are you? You have to talk, I'm good. I'm feeling good. How about you? People used to express, with God's grace, I'm doing good. They used to speak like that. That influences that thought, that self-talk, that interpretation of you influences your thought, that changes your feeling, and that changes your behavior. It looks, energetic. And nowadays, what happened, last couple of years, I'm seeing, if I'm say good, people think something bad about me. And that's the reason they're not, I'm not good, nothing much happening. We don't want to show ourselves we are happy and enjoying our life. Instead of that, we are telling them, no, not nothing, no job, no money, no coronavirus, lockdown, no job, nothing. Please stop talking like this. Talk to yourself. Whenever somebody is greeting you with the how are you, put some, even though it's lie, tell them, because what you are talking to yourself, that listens, your thoughts are listening. You are giving command to your thoughts. The thought changes your feeling. That feeling changes your behavior. Please work on your thought process. So I'll give you one activity so that you can understand how it works. Okay, Can everyone use your hand and tell me? Can you show your hand two? Two? No, I don't want everyone to open the video. Just respond to my command. Can you all show two in your finger? Two? Okay. Thank you so much. Can you all change it to five? Five? Show me five in your fingers. Yes. One? Very good. Thank you so much. Four? Wow. Good. Five? One? Three? Good. Thank you so much. Very good. Very good. See, tell me now, who changed your behavior now? This you responded to my command because of me. I influenced you to show all these fingers in your hand. Let me know clearly. No, please. I'm not respond. I'm not a person to work on your body. The how the signals are happen. You give command to yourself. Okay, listen to this person. Respond to this person. I wanted to listen to this person. You give command to your mind. Your mind responded 1, 2, 5, 3. Okay, so that's how it works. It's not me, I'm controlling you. It's you, your own command. You give command to your brain. That command that receives your mind, accordingly it responds. And I can tell you, even now there are few people, they didn't respond, though I was requesting to show 5, 3, 2, 1. No, they said just sit comfortably and looking at my presentation. There are few people did not even tried at all. Why? It is I influenced you, but there are few people, they are not responded. It is me. Is a reason is me? No, it's not me. It is their own command to their mind. They control their own mind. So they give command. No, I don't want to listen to this person. I don't want to. No, why should I listen Babu Rangarajan? Let no, I know what he's trying to say. I know this. I know this model. I know what he's going to tell me. I know. So that's how. That's the command which they are giving to their mind. That's the reason their body is restricted not to give any actions. When you are giving actions, when your hands are moving according to my command, it's not that I responded to your body. No, you give command. That's what I'm telling you, my dear friends. Nobody in this world can influence your feeling. It is you, your own thoughts. Being happy is your own choice. Being happy is our own choice, in spite of any situation. Whether sometimes situation happening according to your own wish, sometimes according to unpleasant situation happen because situation is not in our control. We have control over how I can understand the situation and what kind of self-talk I can talk to myself. That influences your feeling. Thank you all the chat responses. Thank you so much. I respect you all. Let me give you some examples. Sir, no, sir, no, sir. Sir, same, sir. Yeah, thank you so much, sir. Please leave it. This is my last slide, sir. Leave it, sir. This is a slide which I wanted to communicate to you, everyone. This is my last slide. So please understand, I just introduced the skeleton of the model, but I'm going intense with the model. Are you comfortable? Yeah, comfortable with the way I move on? Yes. So I'm going to intensely take you to this one. Thank you so much, Shalini ma'am. Okay, I'm going to take even intensive to understand this cognitive model. Whatever I'm just sharing with you all, just a skeleton model. I'm going to take with example now. Okay, my example is I'm making a call to my friend. Okay, I'm making a call to my friend. He didn't attend my call. I got angry. I'm attempting to call. He didn't attend my call, and I got angry. So now tell me, who made me angry? I'm attempting to call. I made a call, but he didn't attend. But I got angry. So who influenced me? Why I'm angry now? Is it my friend disturbed me? Is it a friend is a reason for my anger?
No.
Yeah. No, it's our mind. Thank you, Kaushika Das. Thank you, Shalini ma'am. It's not about outside world, my dear friends. It is how I interpreted. That's called option A. What is option A? So option A is I'm talking to myself that I'm attempting the call. He didn't attend. Within the 30 seconds of ringing time, I'm talking to myself. He wantedly not attending my call. He just ignoring my call. He don't want to talk to me. He just showing off. He just no. I hate him. If my mind interpret like this, I get anger on him. The same situation, making a attempting call to a friend, my friend, he's not angry, he's comfortable. Same situation, for me it's anger. The next person who is sitting next to me, he's also calling his friend. The friend is not attended the call. He's very comfortable and moving with his own work comfortably. How come that person is handling very comfortable, whereas me, it's very difficult. I'm just ventilating my anger. Whereas that person is same situation but comfortable. This is what happening every part of your life. Same situation, sometimes you go disturbed, sometimes the other person is very comfortable. So who is making them comfortable? It's not that situation is making you comfortable, how you interpret and what kind of dialogue is going on inside, that influences your thoughts. That's it. So other person is understood themselves is like, maybe he's busy, maybe he's attending webinar, maybe he's in class, maybe he's in presentation, he will call back later, I'll talk to them later. That's what his own interpretation is. Cool, comfortable, and then he's moving with his mind comfortably, doing all other works happily. That's what we need to be understand here. So in every part of your life, nobody disturbs you until otherwise you yourself make what kind of interpretation self-talk happening inside that disturbs you. I'll give you another example so that you can easily understand, because we are going deep into understand this model, and then I'll come back and connect with all the current pandemic situations. Okay, let you understand with the example so that usually you can connect with my the core of what we are going to see today. As soon as you see a snake in front of you, wherever you are sitting at your comfortable home or office, wherever you are, all of a sudden you are noticing there is a snake. What will happen to you when you look at the snake? The situation is snake. Do you feel comfortable or do you get scared? It depends upon
Fascinated.
how. Thank you. Thank you, ma'am. So sometimes, what happens when you look at the snake on all of a sudden, we get scared. Thank you, all the chat responses, horrified. Sometimes we get fear, we ran away, right? So who made you fear? My question is that as soon as you snake, you got fear. So now tell me, who made you fear? At the same situation, whereas the person sitting next to you is very comfortable. For you, it's fear. For them, it's comfortable. So it's your own interpretation, self-talk. I always focus on every situation, what happens to you without your knowledge. Your mind starts interpreting, oh my God, that is dangerous. That is self-harming, that will poison us, that will make us die. That I give interpretation to particular snake in this manner. That's why I'm getting scared of. So who made me scared? It is not the snake. I attach to the meaning to the particular situation with my interpretation self-talk. That made me scared. So how I wanted to avoid, how I can make comfortable even though the snake is in front of me. Don't worry, change your interpretation self-talk. You have been trained so far in your past experience, maybe from 5 years, 6 years, somebody told you the snake will harm you, snake will they will bite you, snake will come only to kill you. Some kind of interpretation which keep running inside your mind, even though till now your age is 20, 25, 30, 35, 40, who knows. Still we are carrying that same interpretation that snake means dangerous. There are few people, they understood snake, the snake is not dangerous. Maybe the snakes come for different purpose. Maybe I can kill the snake, or I can catch the snake, I can give it to forest department. There are so many people, they think differently, that's why they go and catch. Same situation, not same response to everyone. Same situation, there will be alternate emotions are always there, even though that's scary. But there are few people, they are very comfortable. How they are comfortable? Because they enjoy, they see as, they don't see as how you are seeing. Their interpretation dialogues are different. I'll give you another example. Yeah, thank you for your response here. The giving command my mind that don't get scared. Don't say like that. Tell them that I'll handle, I will easily catch, or let me call somebody, let me see why this snake is here, what is the possibility how the snake reached my home. Maybe somebody is disturbing outside, or why this came here for safety purpose. Let me try to understand the snake, or try to catch, or try to move away, make myself safe here. Is there any danger? If you put yourself in this situation, analyze, rather than getting into aggravate of your fear, just see what is happening. Put your thoughts on a mode of responding, not like reacting. You may have these two words, you must be listening to somebody. Response and reaction. What is response and reaction? Can anyone tell me what is the explanation of responding or reacting? This must be, you are well aware about this concept, responding and reacting. Okay, we have a very less time. We are going to complete our webinar in another few minutes. Let me also give you that what is responding and reacting. Reaction is without your thought influences, you just reacted. Responding means you give some thought over it. Your thoughts influence. Take some time to respond. Sometimes we are being conditioned to that. Respond is thinking before you speak. Yeah, very good. Thinking with the support of thinking is respond. Without support of thinking is reaction. See, at this moment, if you see at this moment, we are in a pandemic situation. When somebody say hi, hello, when try to shake hand with you, will you respond or will you react? Will you respond or will you react? React means, oh yeah, hello, hi. You shake hand with other person is reaction.
Respond.
If you respond means you think something, right? Oh no, namaskar, yeah, namaskar. So we change quickly. We use our common sense and we think something and then you respond accordingly. Respond means you are using kind of intellectuals. Reaction is always, we try to react, right? Whenever somebody say hi, you also say hi. When somebody share their number, my name is Babu. If I leave it like this, you start your telling your name. That's what is required and that's what our understanding is. That's the reaction. So when he says the name, is it necessary I need to say the name? If you put some question, then that's a reaction. I don't know, that's a response over it. Okay, good. Okay, let me move on to here and then we will come to a more interesting part. On any situation you take it, nobody is disturbing you, my dears. The disturbance are happening based on what kind of interpretation self-talk which keep running inside mind. This interpretation self-talk are happening, it's already trained. Your mind is trained accordingly. When you are facing any situation, it starts coming in. I'll tell you, in any of the public places, if you meet a person who's very good to you, a very good friend you are meeting and outside of the public place, how your reactions will be. You show a lot of emotions and saying, hi, hello, how are you? Long time I didn't see you. How is everything at your home? The energy comes in. Did you see the energy when you look at the person whom you like it on a public place? You show your emotion. You know what happened when you look at the person, your interpretation stuff. My God, this person is here. Oh my God, I didn't see you for a long time. You already interpreted inside. That's the reason the energy flows automatically. So your mind already has something which is holding you, and that's the reason you are coming out with all kind of emotional reactions like this. Okay, so interpretation self-talk happening every second of your life, and that's a part of our life. That's happening everybody's life. That relates to your thinking, that changes your feeling, that changes your behavior. Okay, with this model, let me come to a current situation. Now I've been talking about there are many people who are suffering because of this COVID-19 symptom. There are people who are already affected. There are people who are affected in the home quarantine. There are people who are admitted in hospital. There are few people not even affected anybody, but still they are at home, but still they undergo a lot of pressures. Elderly people, they undergo a lot of pressures. And even children, they go under pressure. Different reasons. But how to overcome all the pressures, whatever the age they are, whatever the situation they are in, how to overcome that situation, nothing but their own interpretation, self-talk. Please, that's a tool you need to introduce to everyone, whoever you meet, whoever you hearing somebody that they are affected with something. Please teach this model the way how I taught you all right now. Take this example step by step like this, and this model will definitely help the people to understand. So situation is COVID-19. Let me talk from our home, whoever at home. Nobody is affected with COVID positive. They are normal people, but still their anxiety level is very high. They're not ready to go out, and still they are at home for a long time, and they're worried about going out for catching all this kind of symptom. How you can teach this model? Tell them that situation is you cannot change. We don't know when this getting normalized. We don't know how this corona will go out of the world, but still we need to cope up. We need to have our own normal life. We need to have our own happy life to lead on, even though something is happening, situation is going on. How you need to change situation, you cannot change. The thought process inside you can change. How to talk to yourself, that you can train your mind to think positive. How to train your mind, talk to yourself. Now situations are coming down and I'm feeling safe. I'm taking measures to not to affect. I'm taking some steps not to influence on myself, and I'm very conscious about what I'm doing. I'm feeling good, my body is supporting, I'm feeling good, I'm feeling happy, relax. Talk to yourself like this. You're thinking, it releases your chemical that changes your feeling, and then your behavior accordingly, feeling good and enjoy your life. Yes, thank you. positive vibration in our, wow, we can give positive vibration. Your word has a positive vibration. What kind of word you speak to yourself, that creates a positive energy. Okay, let me tell you, person who affected with COVID, they are in home quarantine, what to talk, how to talk. Simple. They wanted to change the thought process. They have to talk to themselves that the interpretation goes inside that now I got positive, fine, I accept, I understand. First, let them accept this situation. Okay, there are few people, they don't accept why God punished me, why I am suffering this, what I did wrong for anybody, why I'm suffering. Please don't get blamed by this kind of things. Leave it, accept. Okay, something which gone into my body, that called coronavirus, COVID-19, fine, let go and do something. But I know whatever it goes inside, it heals my body. It entire body is getting ready, and I'm going to heal from this. I know I can easily cope up this situation, and I'm comfortable. My body is getting healed. I'm every day I'm getting strengthened. Every day I'm coping up. Every day I'm getting more and more positivity. I feel good, I feel happy, I feel energetic, I feel I'm enjoying my life. See that dialogue which goes inside your body continuously, that whatever it goes inside the COVID-19, don't worry about it, that has different role to play. And with your kind of thought process, definitely you can hold on your feeling into happy. Once your feeling is happy, and automatically your behavior is more confident. The most of the problem people may have this because of the misunderstanding about the message which they saw from the social media, and they talk to themselves, maybe I may die, maybe something going to happen, maybe my SpO2 is very less, maybe my lungs will be affected, maybe I may not live, maybe I'm going to lose my life. See, if you give this kind of a dialogue to your body, what will happen? Your body will respond to your command. What is your command? I'm not feeling well. That's a command you are giving. The command which releases the chemical, that releases chemical, it changes your feeling. The feeling changes your behavior, and you feel dull, you're not able to eat properly. Hello, please change your mindset. Please cope up. Whatever the situation you are in, you need to have a confidence. How you need to maintain confidence? Please understand. Stop all this kind of dialogues. Please talk to yourself, feeling good, I'm healthy, I'm improving myself, even though which my coronavirus is inside, which I'm going to cope up. There are many number of people in the world which is they're coping up same as others. I'm also coping myself. My body is getting ready. The antibodies are getting ready inside the body. I'm getting myself stronger and stronger and stronger every day. Though I'm getting improvised. See the dialogue which what goes inside, because your dialogues are the command for your mind. Your interpretation is a command to your mind. So what kind of interpretation you are giving, that changes your feeling, and the feeling gives you confident and comfortable. Please, my dear friends, please make sure that you are overcoming this situation. This situation it's happening for the entire world, but we need to be very strong enough to understand and cope with and fight for this. So being a mental health, so coping up with the mental health is nothing but what you're talking to yourself. Your dialogues are the most important for your mind, because your mind doesn't listen to anybody, it listens to you. What others are talking about you is not matter here. What you are talking to yourself is a matter. That dialogues changes your feeling, that feeling changes your behavior. So with this cognitive model, I will be stopping my presentation. Thank you so much for the lovely opportunity to share my experience with you all. If you have any questions, definitely I'll be happy to answer you all. Thank you so much for the opportunity by Bharati Dasan University and the young team and the organizer, Suresh sir, and then head of the department, social work. Thank you so much. It was a great opportunity to share my experience. Do you have any questions? And I'm happy to answer you all. Sir, I have a doubt. Is everyone suggested that optimistic thinking should be practiced, should be avoid run through news, all sort of informations by being positive, because all the time negative impact. So it's up to you. There are few people, they are comfortable, sir. So I'm not telling you don't watch news, don't watch newspaper. It's up to you. If you are having a coping mechanism, if you are not influenced by this news and newspaper material, you can see that. If you think that news is not influencing you, better you stop it. That's all. You need to avoid from all the influences, right? So I'm not saying everyone to stop watching news or watching newspaper or avoiding social media. It's fine. You cannot avoid this. You have to cope with this. Only thing, you need to strengthen your mind. That's it. So what, in spite of any news, in spite of any kind of information which they're sharing from social media or TV news channel, I know how I can maintain my body and I can maintain my mind. It's up to you. So you can definitely maintain your body and health, sir. Sometimes we change our thought process but feeling not good, so what to do? So it's not that you are not worked properly, your feeling has to change according to your thought process. You need to change your thought. How to change your thought? Continuously, monitor yourself, understand yourself, visualize yourself that you are being good, you are improvising, you are doing good, so that way it will be helpful. So how a bipolar disorder person can stay away from negative thoughts? Yeah, so bipolar is, again, it's a mood stabilizer. They have to maintain their moods. We need to know what kind of mood they are, either in elevated mood or manic state or depressed state. It depends upon, even though in spite of what kind of disorder they are, please understand this is a thought process which help you. We need to undergo what kind of thought, either my automatic thoughts are coming and disturbing us, or my automatic thoughts making us feel comfortable. In spite, we cannot change the situation. We cannot say go corona, go away. We cannot blame anybody in the world. We have to save ourselves, because our emotions are our responsibility. We need to take care of our own mental health, because we have to do a lot of responsible work. So better avoiding all kind of this negative interpretation, self-talk. Avoid that. Okay, I'm good, I'm moving forward, I'm seeing, I'm improvising, I'm making myself good, I'm making myself strengthened, I'm every day I'm improving better and better. Put this statement, let's move on, just put your statement. Always practice the guidelines what government has given to you. Apart from that, just don't worry about whether it will affect or not. Even though if you affect, what next? I got positive, what next I need to think of, rather than, oh my god, I got affected, I don't know, something is going to happen, I'm going to die, what will happen to my future. No, please, let everything go on, move on. Okay, so let them enjoy. Affected, okay, what next? Possibility, treatment, okay, I'm accepting, I'm going to take the treatment, I'm going to do my procedures, let me overcome, let me challenge, let me change my, the doctors will help me with my bodily changes. Put trust on your doctor, just keep moving forward. That's it, you will be all right. Even though if you're affected by corona, there are many people, they are coping up, they're enjoying their life after coming back from corona. So can you suggest some day-to-day tips for maintaining mental health at home? Sir, very simple, sir. Talk to everyone, good information. Talk to them every good possible way. Automatically the mental health will be strengthened, sir. What is the best defense mechanism we can use to overcoming this? Nothing. There is no defense mechanism. Don't go to the theoretical aspects of all defense mechanism. Just understand, you words are the defense. What kind of words you speak, that will give you a defense. Okay, the defense mechanism concept is there. Yeah, I understand, but still, what kind of dialogue you speak, you affect yourself. The dialogue what you speak to yourself, that defines you. So choose wisely what kind of dialogue you need to speak to yourself. That's the only best way it's possible, because you have to take care of your mind and mental health. Then automatically everything will come into place. Once you take care of your mental health and you enjoy yourself, and your creativity, presence of mind will be preserved. So once you worry, understand, keep talking to yourself very badly, then automatically it goes. At home, you can do an activity where you set a goal and do some solution, set a goal and achieve it. If you are at home, if you are in a quarantine, take something called cooking. New varieties you can try, you can cook, and you can feel good. Whenever you achieve something, you feel wow, right? You decided to do something and you achieved it. You wanted to cook something very interesting food, then you achieved it, then you feel good. So like that, take some goal and achieve that. Take goal and achieve, set goal and achieve, then you are feeling positive all the time. All right, so thank you so much. With this, I officially hand over this webinar platform to the host, MSW department, Bharatidasan University. Thank you so much. It's a pleasure talking to you all. Share this message to near one, dear ones, to take care of everyone's mental health. Thank you so much. Jai Hind. Thank you all for the feedback which I've been seeing. Thank you so much. I'm humbled with your feedbacks. Thank you. Host can take over.
Thank you, sir. I would like to welcome our team member, Malar, to deliver a vote of thanks.
Thank you, Mr. Imran Shah. A warm good morning. Good morning to everyone. I'm Malarvi. I'm here to present vote of thanks for today's section. Let me take this opportunity to propose a vote of thanks. So I thank everyone gathered here to this 2 days online workshop. I begin with let me thank our head and professor Dr. Mangleshwaran his presidential address and for interacting this webinar. Its world significance of COVID-19, its impact in society, the outcomes and kick are well received by our participation. Thank you, sir. Thank you so much for connecting with us. I would like to thank our chief guest, webinar speaker, Dr. Babu Rangarajan sir, for visiting and enlightening us with their knowledge. Today's workshop was full of knowledge and interesting things. It gave deep insight into the topic and also revealed some interesting facts. The point where Dr. Babu Rangarajan sir told us about the mental health problem was really informative. I'm pretty sure the previous knowledge and that about Dr. Babu Rangarajan sir has gave us will definitely help us on our studies and future. Once again, I would like to thank you, sir, for taking out time from their busy schedule and enlightening us with the knowledge. Thank you so much, sir. And I would like so thankful our head of the department, Dr. Mangleshwaran sir, for giving permission to organizing this workshop and inviting Dr. Babu Rangarajan sir to conduct it. And I want to thank my social work family, Professor P. Ilango, Assistant Professor Dr. J.O. Jerida Nanju, and Assistant Professor Dr. D. Nirmala, Dr. R. Rajavel, and our guest faculties, Dr. M. Suresh Kumar sir, Dr. R. Karthikeyan, Dr. R. Selvamani, and PhD scholar and MPhil students, and my second year classmates, and my senior and my first year brother and sisters from Bardhasan University Social Work Department. Heartily thank you everyone. Thank you for your support. Dear participation, thank you for your joining us and for your support to our department. Thank you. And I believe the section was useful to you all. Thank you. And I would like to thank both my fieldwork faculty and my program director and my organizing committee member, Mr. Imran Shah, Mr. Anbudurai, Ms. Maria Sakundala. Thank you for your cooperation and teamwork, who really hard work and to make this event successfully. And I would like to thank my family members, all-time support and to help us webinar reach and familiar. Thank you everyone. Also thank you to all the students present here for paying your attention and listening. And I would end my speech here. Thank you once again. Thank you so much, Paran.
Imran Shah.